This is a video in clinical medicine from the New England Journal of Medicine.
A mobility assessment is an important component of the overall assessment of well-being in an older person. A change in mobility or walking speed can be an indicator of the risk of falls and frailty. This video demonstrates a method for performing a focused mobility assessment, including standing up from a chair, known as the chair stand test or the sit to stand test, the 4-stage balance test, and a gait speed measurement. Because impaired mobility is a leading contributor to the loss of functional independence, an assessment of mobility is indicated during every comprehensive geriatric assessment. A mobility assessment can also be performed specifically to assess for frailty, an initiative from the Centers for Disease Control and Prevention called Stopping Elderly Accidents, Deaths and Injuries, or STEADY, recommends that gait, strength, and balance be evaluated as part of a risk assessment for falls and in any patient with a history of falls. A mobility assessment should also be considered in any patient who has had a recent change in functional status. Finally, mobility should be assessed when frailty is being considered as part of a perioperative assessment. A mobility assessment is not recommended in patients who cannot safely walk or for whom a prescribed assistive device such as a cane or walker is not available during the assessment. This assessment should be performed with caution in patients who have a known diagnosis of orthostatic hypotension. It may not be appropriate to perform this assessment in patients who have symptoms suggestive of acute coronary syndrome, such as chest pain. The gait cycle is the time taken from one foot striking the ground to the same foot striking the ground again. It consists of a stance phase and a swing phase. To have a normal gait, a person must maintain adequate balance, a center of gravity, and an upright posture. To perform a mobility assessment, you will need a device with a stopwatch function. To perform the chair stand test, you will need a chair without wheels. The 4-stage balance test does not require any additional equipment. To measure gait speed, you will need access to a straight 8-meter long space with no obstacles. This 8-meter distance comprises a 2-meter acceleration zone, a 4-meter assessment zone, and a 2-meter deceleration zone. Before you begin a mobility assessment, describe the procedure to the patient. Explain that you would like to assess how the patient stands up after being seated in a chair, as well as to assess balance and walking. Ask the patient to wear shoes and to use any prescribed assisted devices and eyeglasses. Conduct the chair stand test. Ask the patient to sit in a chair and cross the arms over the chest while keeping the feet flat on the floor and the back straight. Then ask the patient to rise from a seated position to a standing position while keeping the arms crossed without using the armrests of the chair for support. Next, ask the patient to sit again while keeping the arms crossed without using the armrests. If the patient can complete this action, ask the patient to repeat the procedure as many times as possible in a 30-second period. Count the number of times the patient reaches a full standing position. The normal range for the number of chair stands completed in a 30-second period varies depending on age and sex. This table provides the cutoffs for below average scores. A below average score indicates an increased risk of falls. Conduct the 4-stage balance test. In this test, balance is assessed in 4 positions. First, ask the patient to stand up straight with the arms by the sides and to hold this position for 10 seconds. Next, ask the patient to adopt a semi-tandem stance and to hold this position for 10 seconds. Then, ask the patient to adopt a tandem stance and to hold the position for 10 seconds. Finally, ask the patient to stand on one leg and to hold this position for 10 seconds. The test is considered to be positive if any of these positions cannot be held for 10 seconds. A positive test indicates an increased risk of falls and should prompt further evaluation. Measure the gait speed. Ask the patient to walk at the usual pace and to use any prescribed assistive devices. Have the patient walk without interruption along the 2-meter acceleration zone, then the 4-meter assessment zone, and then the 2-meter deceleration zone. Stand slightly behind the patient and avoid talking to reduce distraction. Use a stopwatch to measure the time it takes the patient to walk along the 4-meter assessment zone. Obtain the measurement in seconds to the nearest hundredth of a second. A gait speed of less than 0.8 meters per second is considered to be slow. A mobility assessment is an important component of the overall assessment of well-being in an older adult. Completion of a focused mobility assessment, which includes the chair stand test, the 4-stage balance test, and a gait speed measurement, can aid in identifying patients who are at risk for falls, frailty, and functional decline.